How about now?
Now I
Good.
can.
Good, thank you. So I'm going to make a presentation of Sari's case report. She could not be here today, so I offered to do her case report. She used this case report has not been published. She basically wrote it for this webinar and the newsletter, and she used, as far as I remember, she used the CARE standard to fill it in, and she said it worked fine to do it. So it's about how she has been treating secondary dysmenorrhea. Sorry, it's a difficult word. With acupuncture, and she had this. Or the background for this condition is that it's pain during menstruation, and it's often a cramping pain, and it is a really big problem in women in the reproductive age, as somewhere between 16 to 91% of women are estimated to have this problem with severe pain during menstruation. One of the things or the issues with it is that it has a really great impact on their quality of life, as some of them are so bothered with it that they are not able to work. And acupuncture may be considered as a treatment modality for this, and that is what Sari did. She had a patient, 39 years old. She was a healthy woman, did not have had any children, and had not been pregnant at all. She had a chronic painful menstruation with heavy menstrual bleeding for more than 10 years, and the pain has just been increasing over the years, so it's just gotten worse and worse. She had pain in her lower abdomen, in her back, and in her leg, and it all started 1 week before she was going to have her period. She also experienced bloating. The menstrual cycle was regular, but the pain was so unbearable that she was not able to continue her normal everyday life when she had these pains, and often she could not work at all. She had tried different treatments, and nothing had been successful in helping her. The clinical findings is that the woman told Sari that the pain was fluctuating between dull aching and stabbing pain. When it was at its worst, the pain score was between 8 and 10. So the scale is between 0 and 10. So she is experiencing the highest form of pain. And she explained to Sari that she was sometimes the pain was so bad that she was afraid of dying because of the pain. The woman found that if she laid down in a fetal position, that could ease the pain. However, if you put pressure on her abdomen or just touch it, it would worsen the pain. She had tried to put on heat patches on the back, and she quit that again because she had the feeling that it would worsen the bleeding. When the woman was in Sari's clinic, Sari experienced that her breathing was shallow. She had a pale complexion, and she was just overall very sensitive and emotional. The clinical findings were also that her legs were often sore due to muscle tightness, especially around the menstrual cycle. When Sari examined her, she found that the abdomen was tight and sensitive to touch, and the lower abdomen was even worse or more sensitive to touch. Her pulse was wiry, deep, thin, and tight. The tongue was purplish puffy edges, small, and a thin body. So the intervention was weekly acupuncture for almost a year. The woman had 49 treatments. It was with manual acupuncture, minimal needling, and minimal stimulation. The needle was left in for 20 minutes. Routinely, Sari used Ren 6, pericardium 6, and spleen 4. And depending on where in the cycle the woman was and how the symptoms were, she would use different spleen points. She would use lung 7, kidney 6, Sanjiao 5, gallbladder 21, do 20, large intestine 4, liver 2, liver 3, liver 8, stomach 25, and stomach 26. Good. And after the fifth consultation, Sari asked the woman to start doing breathing exercises because, as I wrote in the beginning, the woman had really shallow breathing all of the time. So she decided that it would be a good idea to get the woman to start with this, and that she could also start to do exercises of her own choice. And she found, she joined a yoga class, and I think she did really good in it, as far as I remember. The woman, as far as I remember, was not able to do any sort of exercise because it simply worsened the pain. The measured outcomes was the pain severity from a scale from 1 to 10 or 0 to 10. The woman was asked to keep a pain diary and also to write down in the diary whether or not she was able to work when she had the pain. She also had to write down the quantity of menstrual flow, and the way that she did that was just to write down the number of time that she emptied her menstrual cup. She had a menstrual cup that she'd used, so it was a little bit easier to keep track on that. So the outcomes of the treatments was that within the first 1 to 3 cycles there was no change at all. At the 4th cycle, the pain was for a shorter time and was less in the pain score. She also experienced less bleeding. And when she came around to the 5th menstrual cycle, she had significantly changes. She was able to work. This woman had not been able to work for more than 10 years when she had the pain. So now she was able to work. The pain score was between 2 to 5. And if you recall, before the treatments, she usually had pain between 8 and 10. And she was now emptying the menstrual cup every 4 to 8 hours. And before all of the treatments, she had to empty the cup every hour. So that is a big change as well. She felt like she had more energy, she had a better digestion, and she also experienced quite a lot of anxiety, and that also decreased with these treatments. She also started to sleep much better when she slept. So what does this show? That the treatment showed an effect on the pain severity and the bleeding. And Sari also wrote in her discussion section that you should really be aware of having good communication with the patient, because this patient needed quite a lot of treatments, and she also did not experience any changes within the first 1 to 3 cycles. So when you're dealing with something as difficult as this, it is really important that you have open communication with the patients and let them know that sometimes you need to be patient and wait for something to happen. She also suggests that there should be a lot more research on this area. And she also wrote that one of the things to keep in mind is that there was no change in the first 1 to 3 cycles. So you need to be really, really patient. So that was a really quick presentation of Sari's case report, a really good paper, I think, with some interesting results. Definitely something I would take a look at if I was going to treat this condition in my clinic. Yeah, so thank you. I will just keep this really, really short. We will have another newsletter in the beginning of June, which will be published in the beginning of June. And then we will have a webinar connected to the newsletter on the 21st of June. And it is in the same time as today, and hopefully only for an hour at that point. We have been talking a little bit about the theme for the newsletter, but we are not quite sure yet, but we will let you know as soon as possible. But in the beginning of June, a new newsletter, and on the 21st of June, same time as this, we have a new webinar, and the theme is not set yet, but it will be on a specific condition. So thank you very much. And Aram just wanted to give a few closing remarks.
Yes, thank you. Again, thank you very much for participating. One of the things that I wanted to stress, if there's any recording issues, if you missed out some of the presentations, I urge all of you to go to the YouTube channel. We are expanding our coverage in the YouTube channel. We will have Meet the Expert series, all of the interviews, and this webinar will be in short, concise format, uploaded for your pleasure, for your viewing at your leisure. So make sure that you subscribe to the YouTube channel and act the notification bell, so when the new content is added, you'll get notified immediately. Thank you again very much, and thank you, Anja. Is Dr. Yair want to have some closing remarks?
Oh, just thank you all, and thank you for your efforts. And it was wonderful for me to hear both all the presentations, and I hope some people get inspired to write case reports. That's the bottom line. So thank you all, and see you soon. Enjoy the holiday.
Thank you.
Thank you. Good night to all.